The IntelliPAP 2 patient menu. The first item that a patient will see is humidity, and this patient can turn it off all the way up to 5. The default setting is 3, which is fine for most patient needs. The quick view menu gives a patient a very quick view of how they're doing. They have their adherence score and usage threshold on the front page, and then they have their 1, 7, 30, and 90-day summaries of their 4+ hours usage, AHI, central apnea, average daily usage, and poor mask fit. The 4+ hours would change depending upon the usage threshold set in the clinical menu. Smart code. This is the smart code menu that gives patients access to their smart codes: 1, 7, 30, 90. A compliance code, which gives date code information, which gives long-term usage. The date code, which gives date and adherence information. The serial number of the device, and the smart code RX. Smart code RX I will talk about separately. CPAP settings. So a patient has access to view this information but not make changes. So they can see what their upper and pressure lower limits are, but they cannot make changes. Depending on whether or not the feature is enabled, they can change their SmartFlex settings. So they can change their settings here. They can change it to always on or ramp only. And then they can also change their rounding. So here again, we try to give graphical representations of how the rounding works so that a patient can better understand what the settings mean. The ramp, if enabled, then the patient is able to make changes to the time but not the pressure. Humidity is also in the CPAP settings, but is also available on the front menu since that is a commonly used item. Tubing changes. If a patient does change their tubing, then they can come in here and change the diameter and the length. They cannot change whether or not there's a bacteria filter. The bacteria filter is related to hospital use. The volume control of the master volume of whether or not sounds you hear when there is an error or you place the SD card. The brightness, and this, the patient can change the brightness of the display and the controls. And again, they can change the active or standby brightness. And they cannot lower the active brightness below what the standby brightness is. And the enable menu allows, if enabled to the patient, allows them to change the auto stop and start and the notifications. The clock settings, a patient can change the current time, they can change the format, or they can set a wake-up alert. If they turn the wake-up alert on, then they can set a time for that wake-up alert to go off. Very easy to change. And they can also adjust the volume of what they want that wake-up alert to be. The add-ons is the place where the patient would go to turn on the Bluetooth in the unit and pair the unit with their cell phone or smartphone or their oximeter. And the patient also has access to the information as far as the compliance meter, the serial number, the version of firmware, and the BIOS version, and that information is available for possible troubleshooting. And that is the patient menu of the IntelliPAP 2.